Good morning and welcome to this virtual policy forum on safeguarding civilians during a pandemic, the repercussions of COVID-19 on the protection agenda. This event is co-hosted by the International Peace Institute, OCHA, and the permanent missions of the United Kingdom, Canada, Niger, and Estonia to the United Nations. My name is Namie Di Razza. I am a senior fellow at IPI's Brian Urquhart Center for Peace Operations and the head of the Protection of Civilians program of IPI. With more than 5.5 million cases and 350,000 deaths confirmed, COVID-19 has actually diverted a lot of attention and resources. Yesterday, during the Security Council's open debate on the protection of civilians, the Secretary General reiterated the need to respond to his call for a global ceasefire to facilitate the response to COVID-19 pandemic. And he highlighted the severe impact of the health crisis on vulnerable populations in need of protection. COVID-19 has had various and major disruptive effects, but it has not stopped atrocities, violence, and abuse. On the contrary, the pandemic has actually raised new protection concerns for humanitarian workers, peacekeepers, and human rights defenders. Many violent actors and armed groups have increased activities and attacks and are using the health crisis to gain power and control. Threats against civilian populations are expanding and aggravating, and existing vulnerabilities are being amplified by COVID-19 and containment strategies. In parallel, protection actors have seen the ability to operate and fulfill critical function incredibly constrained. International organizations and NGOs working on peace and security, on human rights and humanitarian assistance need to support containment measures to limit the spread of the virus. In the face of travel bans, lockdowns, social distancing, remote work arrangements, and even more reduced resources, many of them have had to revamp their operational strategies and way of working. Today's panel discussion aims at analyzing the impact of COVID-19 and containment strategies on the protection of civilians, share some initial lessons from the field, and explore policy and practical options to ensure adequate protection responses in a time of pandemic. We are very lucky to have very distinguished speakers with us today. And before we turn to the panel, I would like to invite Ambassador Mr. James Roscoe, the Acting Deputy Permanent Representative of the United Kingdom to the UN, and Ms. Ilse Browns-Kerris, Assistant Secretary General for Human Rights and Head of the UN Human Rights Office in New York, to make opening remarks. Ambassador Roscoe, you have the floor.
Many thanks, Dr. Di Razza. Firstly, I'd like to just thank IPI for hosting us virtually, and to our co-organizers and all those who've agreed to share their views with us today on this critical subject. As usual, the Protection of Civilians Week has provided the opportunity to exchange views on a range of issues as we seek to address the harsh realities that face so many people living amidst conflict. And unsurprisingly, this year, we are turning again and again to the same issue, because COVID-19 has dominated the news and impacted significantly on lives across the globe already this year. And it's set to add further suffering to that inflicted by armed conflict. In terms of our immediate response, the UK is leading with partners and allies to do 4 critical things. The first is to support an effective and coordinated global health response to COVID-19, and this is being led by the World Health Organization. The second is to try and reinforce resilience in the most vulnerable countries, and I'll come back to that. The third is to pursue treatments and a vaccine, and as you know, we are hosting the Gavi Summit on the 4th of June, but also are the most significant investors so far in the search for a vaccine, and also ensuring equitable global access to any successful vaccine candidate once it's produced, and I think that's critical too. And finally, we're doing what we can to support and shore up the global economy. But I think when it comes to the protection of civilians with respect to COVID, unfettered humanitarian access is going to be one of the most critical elements in protecting civilians in armed conflict. The UK fully supports the Secretary-General's call for a global ceasefire and his appeal to open up spaces for diplomacy and protect the most vulnerable, critically allowing for that humanitarian access and to focus our collective energies on fighting COVID-19. It's clear that without unfettered humanitarian access, the supply of aid is restricted, it's slower, and it's costlier. As an example, in Syria, the Assad regime continues to prevent aid from reaching millions of people. And the Secretary-General has been clear that cross-border access to the northeast and northwest of the country is required. The COVID-19 outbreak in Syria makes this all the more pressing. And it's imperative that all parties engage constructively to provide that unfettered humanitarian access, and that the UN Security Council authorizes both the reopening of the Yarubia crossings in the northeast and the renewal of the 2 crossings in the northwest of the country. Of course, for the UN system to mitigate the risks around the protection of our COVID response, we need to ensure humanitarian delivery gets to the communities who need it. Even when some form of free movement or exemption exists for humanitarians, these may be limited to healthcare or exclude monitoring. So evolving bureaucratic frameworks may prevent access where they are most needed. And we're seeing this in Cameroon, where, for example, we would call for efforts to focus on accelerating the response to COVID-19, expanding access to testing, and making sure those affected by violence have access to humanitarian protection without discrimination. Getting the technical stuff right is also critical in tackling COVID. As the Secretary-General has set out in his letter to heads of state, governments need to expedite access and movement restrictions for humanitarian personnel in country, as well as customs procedures for medical equipment such as ventilators and masks to reduce the spread of COVID-19. With each impediment, it's the most vulnerable who are at risk. So I think what we're saying is countries need to step back and look at some of the measures they've put in place rightly to contain the spread of COVID and make sure that those measures aren't themselves an impediment to tackling COVID. A lack of access also means it's more difficult to provide protection services to particularly vulnerable groups. The pandemic is disrupting the access of women and girls, including survivors of gender-based violence, to essential services such as sexual and reproductive health services. Vulnerable populations of all ages, many of whom are IDPs, refugees, and migrants, are particularly susceptible to increased mental health issues due to COVID-related stresses, anxieties, or increased violence, at a time when the very psychosocial support services needed are being interrupted or having their resources reduced. So we think the bottom line is COVID makes it all more complex, and we probably haven't seen the worst of the challenges yet that COVID will bring in conflict zones once the disease develops. But the UK is determined to work with partners, including in the Council and on the ground, to do our best to mitigate these risks and keep pressing for unhindered access, protection responses that are COVID sensitive, and to focus on the needs of the most vulnerable. And we look forward to hearing from others today on how we can take this work forward. Thank you very much.
Thank you very much, Ambassador. It's now my pleasure to turn to Ms. Brandt-Scaris, ASG for Human Rights, for introductory remarks.
Thank you very much. I am very glad to be able to participate at this important discussion that you're having today. And I'm thanking IPI and the co-organizers for paying attention to this critical issue. COVID itself, of course, has come onto our agendas whether we want it or not. So also in the context of protection of civilians, of course, it is de facto the agenda we need to pay attention to. COVID-19 impacts on human rights and other protection concerns in all continents, and it exacerbates, of course, the challenges, as we already heard, exposing also the most vulnerable groups, as both the two initial speakers already mentioned, so I will not go through the groups again. We know who the most vulnerable people are in the societies, is contextual, but their situation is becoming even worse. Despite the Secretary General's call for a global ceasefire, we know that the active conflict situation continues in very many countries, and the risks we already see are actually playing out, that parties to conflict exploit the new circumstances to their advantage, making the situation worse. So it is in this time of this global crisis that universal values and norms, as guaranteed in international law, need more urgent attention than ever. And it also, of course, directly engages the responsibility of states and other duty bearers to uphold those obligations under that law. The Secretary General and the High Commissioner have emphasized that human rights should be at the center in the response to COVID. But we do see, of course, a lot of documented and reported human rights violations across the full spectrum of rights, but in particular also focusing on civil and political rights. We do note in particular the continued stigmatization, discrimination, hate speech, and incitement to violence against persons who either are affected or are presumed to be affected by COVID-19. And this has included extreme cases such as lynching, destruction of property, discriminatory denial of access to hospitals and care for such patients. Restrictions on freedom of expression, the shrinking democratic space, including targeting the media representatives have reported on COVID-19. Protests have been met sometimes with disproportionate responses, including arrests and violent incidents. We have reports of excessive use of force by security forces to enforce COVID-19 restrictions, ill treatment, and in some instances, those have resulted even in death. The efforts to fight impunity are significantly impacted as well, as governments are focused on the health response, so that investigations and trials have de facto been put on hold in many countries. And this, of course, increases the risk that the climate of impunity is getting worse for alleged perpetrators. And in the whole context, in some cases, we have even seen that convicted perpetrators of grave human rights violations have been released from prison using decongestion of prisons for public health reasons as a pretext, misusing it, I should say. At the same time, and the ambassador already mentioned, restrictions on freedom of movement and association have also reduced the footprint of protection actors on the ground, including in UN field operations, leading to the suspension of many protection activities. And that, of course, can have a direct impact on conflict dynamics, in conduct of hostilities, and in turn, therefore, the protection of civilians and the protective environment as a whole. I'd like to stress 3 key points. First, universal human rights are at the heart of protection, outlining the necessary conditions for individual safety and well-being. Protection of the human person is one of the main objectives and an essential part of the raison d'être itself of the United Nations. And it's no coincidence that the Secretary General's call to action for human rights identifies the development of an agenda for protection as one of his objectives. The UN system must do better in protecting people by pulling together our different mandates and operational activities into one coherent whole under one and the same understanding of protection, putting human rights at the center. The pandemic has further highlighted the urgency of the imperative to identify tangible ways of improving implementation of international obligations, in particular international human rights, humanitarian and refugee law. Protection is grounded, secondly, in the realization of basic human rights, and third, human rights are an essential crisis prevention instrument. OHCHR and human rights components of peace missions and special political missions contribute to protecting civilians by undertaking preventive and deterrence measures. These include robust human rights information and analysis, which can trigger early action, public reporting, contributing to restraining perpetrators of violence and building pressure for political solutions and accountability, advocacy to change the behavior of parties to conflict, and joint operations together with other mission components, such as military and police, when presence is critical for protection. Finishing up, just two very brief examples. In Afghanistan, UNAMA Human Rights Unit tracks civilian casualties and issues public reports and figures attributed to the parties, and this has helped in the situation that all parties change their behavior, since it is clear that all parties have actually committed violations. And we also have examples in DRC where MONUSCO, the Joint Human Rights Office, has facilitated the creation, revival of protection networks throughout the country to boost early warning and transfer human rights competencies to local protection actors. And that has maximized MONUSCO's and local authorities' responsiveness to protection alerts. So the exceptional times we live in all around the world, it means it is incumbent for us to act to prevent the pandemic from jeopardizing progress in the protection of civilians, and to ensure that people and the fulfillment of the human rights are always placed at the front and the center of all activities. Thank you.
Thank you so much, ASG Brent-Scaris. I think there's a lot to unpack already, and it was a very helpful overview of the different protection challenges that are faced in the field. So let me now turn to our panelists to further explore these issues. And let me first introduce them. Ms. Laetitia Courtois is the head of delegation of the International Committee of the Red Cross to the UN. She previously worked for the ICRC as the head of regional delegations in Venezuela and Mexico, and as the deputy regional director for Asia and the head of sub-delegations in DR Congo, Palestine, and Nepal. Mr. Kofi Wogomebu is the Senior Protection of Civilians Advisor of the UN Peacekeeping Mission in the Central African Republic, MINUSCA. He has been serving in UN peacekeeping missions for 16 years, including Burundi, Darfur, DR Congo, and Mali. Ms. Caitlin Brady is the Director of Program Development and Quality for the DRC with Save the Children. She has worked in various crisis settings on humanitarian responses and natural disasters, conflicts, and epidemics, including in South Sudan, Yemen, Afghanistan, Liberia, and the DRC. Ms. Heather Barr is the Acting Co-Director of the Women's Rights Division at Human Rights Watch. She previously worked for Human Rights Watch as the Afghanistan researcher and for the UN on justice reform and human rights, including in Burundi and Afghanistan. Ms. Natasha Emerson is the Protection Advisor in the Operations and Advocacy Division of OCHA in New York. She previously worked in conflict and fragile settings, including on Syria, the Great Lakes, the Philippines, Chad, and South Sudan. So we will explore the issue of the impact of COVID-19 from different perspectives, from humanitarian access to peacekeeping challenges, and from child protection to sexual violence and gender-based needs. I will first give the floor to Ms. Laetitia Courtois from the ICRC. Laetitia, you have the floor.
Morning, everyone. Hope you can hear me fine. Thank you very much for this opportunity for the ICRC to raise its concern on humanitarian access and on some specific protection-related issues. As you know, the ICRC is, as per mandate and priority, focuses on conflict and violence-affected areas, and as such has been looking at very specific protection concerns, be it for vulnerable populations such as detainees, displaced people, or people affected directly by the hostilities, but also looking at how to support weakened systems that are often affected directly by the hostilities or years of non-maintenance. In that perspective, we are quite used to seeing the impact of some epidemics and pandemics, but it is true that today we are looking at a situation that is very much different in terms of scope and impact. As President Peter Maurer mentioned it yesterday to the Security Council, we are on the, with this COVID crisis, seeing how it is becoming a protection crisis, and this needs to be understood very clearly in all its aspects and addressed. I will try to present 4 protection issues that are of high concern to the ICRC: the access to vulnerable population in conflict-affected areas, and the dialogue that is necessary with non-state armed groups, the digital threats, as well as the protection of medical workers and facilities. Starting with the access. When we talk about access restriction, it is crucial to understand that COVID-19 related restrictions are but an additional factor that impacts the access to humanitarians. In many contexts, it is cumulative to armed conflict, insecurity for humanitarians, and those related restrictions have an impact on how we can respond. I'll give you two examples that are very fresh. In South Sudan, we had intercommunal violence in Jonglei state that recently left hundreds of deaths and many injured and need of medical assistance, including surgery for the war wounded. During this attack, a Sudanese Red Cross volunteer as well as staff from MSF were killed and injured. And this came at the time when ICRC surgical capacity was reduced by 30%, as beds had to be reduced to put in place physical distancing measures. Rotation of surgeons is extremely difficult in those places because of the restriction connected to COVID-19. Libya is another example where the fighting is escalating. Protracted conflict has disrupted electricity, water, and health system, as well as other essential services. And with restrictions such as curfews and border closures, we have had enormous challenges to deliver humanitarian aid to keep the supply chain for food, medicine, and basic necessities open. We acknowledge, of course, that that states, especially those with weak healthcare system, need to address this pandemic and put in place restrictions of movement for the protection of their own population. At the same time, it is important to see how this has prevented humanitarians, including the ICRC, on moving goods, personnel, especially at the international level. So we need to understand as well how exceptional those restrictions will be and how will they be maintained in the new normal until the pandemic can be managed, and this will take months. On a positive note, of course, we see that dialogue on protection issues and with authorities have allowed for exceptions. Yet this is also taking a minimal aspect when we consider the overall needs that we have in front of us. The second point I wanted to raise is the protection of most vulnerable group, those people in conflict and violence affected areas, and how a dialogue with non-state armed groups is more critical than ever. Of course, under international humanitarian law, there is an obligation, and there's to discuss with all armed actors, and also to discuss how those restrictions can be lifted, facilitating the movement of people and goods to areas that require urgent humanitarian needs. For us, the dialogue with those armed groups, but also the community proximity, is key to get an impact on the situation. Many groups have implemented different types of restrictive measures that range from imposition of parallel curfews, street patrols, to awareness campaign on COVID and on distribution of aid as well as protective equipment. They have taken also initiatives on the quarantine-like measures, but sometimes those also contradict health standards and may be counterproductive. We have engaged with those groups to make sure that we understand all the limits of the measures and make sure that those measures are also contributing to the response to the pandemic. We also seen that non-state armed groups have unilaterally declared ceasefires, and this has allowed the population to access healthcare, as well as creating conditions that allow organizations to move more freely without worrying about being caught in the middle of hostilities. For us, it's important to continue building on those areas because today when we talk about when the vaccines will be ready, we need to think already by tomorrow on how those vaccines and those treatment will reach out to all most vulnerable areas, which is a component of a coherent and comprehensive response to the pandemic. We are therefore recalling that it is hugely important to facilitate this contact and allow impartial humanitarian actors to engage with those armed groups, even if they are qualified as terrorists or going against some principles. The third point is the healthcare in danger related issues. It is important to realize that we have seen new trends in terms of attacks against medical staff and medical facilities. While on one hand, we see a lot of praise and a lot of recognition for those workers, there's also a lot of stigmatization coming up in some specific context. In less than 3 months, we have recorded over 208 incidents. We know this number is definitely lower than the reality. And those incidents go from nurses being attacked with products, structures being burned down, to systematic stigmatization as this person is considered as bringing the pandemic. So it's important that we react at the same time as we also continue denouncing attacks on medical facilities that take place in such in conflict-affected areas. I think we have all been shocked by the recent event in Afghanistan, where maternity was targeted, leaving women and baby dead. Last point, but not least, is also something we raised last week. The Security Council reports to digital risk enhanced with the current accelerated digitalization of the world due to the COVID-19 reality. We have seen an increased report of malicious cyber attacks impacting the access and hampering the provision of medical services, delaying, for instance, the processing of tests by several days, but also impacting the well-functioning of emergency services dedicated to COVID treatment. When medical services are disrupted, it's obvious that it puts people's lives in danger. Second, we also have seen that the fast-track virtualization of our working modalities has also increased the risk related to data protection and of individual data. As the pandemic asks for more intensified data collection, the problem remains as how it is collected and how it's being used. In that sense, I will maybe conclude with 4 asks. The first one is to make sure that member states and parties to the conflict respect international humanitarian law. I know it's the law, but it's also important to realize how law generates those positive outputs when it comes to humanitarian actions. The second point is to make sure that the COVID restriction do not hamper the movement of humanitarian staff for good and facilitate the access and the delivery of essential services and movement of essential staff between countries. The good practice of granting exceptions is positive and needs to be emulated as much as possible. The third point is to ask that ICRC and other impartial humanitarian organizations are being allowed to continue working with non-state armed groups, ensure that counterterrorism measures and sanctions do not impede the ICRC and other impartial organizations from engaging with armed groups, even if those ones are designated as terrorists. And the last one is to protect medical facilities and protect personal medical at all times. Thank you very much.
Sorry, but thank you so much for this very comprehensive presentation of all these protection efforts related to access, engagement, healthcare in danger, digital risks. I think we need to also hear from other speakers about the different perspectives on these issues. And Kofi, as the Senior Protection of Civilians Advisor of MINUSCA in CAR, you support and coordinate protection efforts implemented by the military, the police, and the civilian components of the mission. And I imagine that the pandemic has impacted the mission's activities like patrolling and community engagement. So can you tell us more about specific challenges that are faced by UN peacekeepers and the way the mission is tackling them in the Central African Republic?
Thank you very much. Good morning or good afternoon, depending where you are. I'm going to give you how COVID-19 has impacted our activities here and how we are trying to cope with the situation right now. Just want to say that COVID-19 itself did not constitute a threat of physical violence against civilians, falling under our POC mandate, but it starts seriously having direct and indirect consequences on the protection of civilians, because measures taken to protect public health, such as scaling back activity to prevent the spread of the disease, is starting having a serious risk on the protection of civilians. Resources in MINUSCA and attention has been directly diverted to COVID-19 response, which means that the other activity is suffering as consequences of those decisions. And also, this is leading to increased exaction towards civilians. Generally, the implementation of the POC mandate in MINUSCA has been affected. at the beginning of the crisis, starting from mid-March until end of April, we've seen that a dilemma of the senior management between staff safety and security and continuing implementing the POC mandate. And also some restriction measures taken to tackle the disease from the host government, and also MINUSCA has a serious impact on our activity. For instance, here there is MINUSCA anti-sentiment among the population, because they pretend that we are not doing much to protect them. So we are very much aware that we're gonna be the people exporting COVID-19 in Central African Republic. So we are very cautious about that, because the RNA cycle is 6 weeks. So we are very cautious about that one. But fortunately for us, it didn't happen because measure has been taken, and fortunately also borders has been closed, which locks some of our colleagues outside, and those who are within, very quickly senior management has taken the decision to not allow people in capital cities, Bangui, where the virus has started, to go to the field offices, and vice versa. This has had a very huge impact on the disease. We also have right now, from the beginning of May, we are in a situation whereby we need to work, we need to implement the mandate. So despite the restriction of movement, despite the instruction given by the host community, we are in a situation whereby it's like, don't do, but do. So in that situation, we've managed to do a certain number of activity. Also, something I want to tell you, it's the community or the Goka population believes that MINUSCA supposed to be dealing with the disease and bring a response. This has put another pressure on the mission. Armed groups have, all of them, 14 of them, have uploaded the SG, instruction to respect ceasefire during this pandemic, but in reality, it's not the case. We even believe that they take advantage on the fact that we are no more moving a lot to spend their territory, and by doing so, they committed some also serious human rights violation. So that is something going on right now. It's we are hearing that might be a decreased funding, peacekeeping or supporting peacekeeping in this particular COVID-19 crisis. But I'm just wondering, what are we going to do if it's happened in a peacekeeping whereby in some of the mission is only the peacekeeping doing the thing. It's the case in Central African Republic, whereby we are not in a government, but we are behaving in a government in all the domain. So let me quickly give you through the 3 tiers of the POC as we do it in a peacekeeping, how we do business. I want to tell you that all 3 tiers has been affected. We did an evaluation after 1.5 months, and we've realized that the 3 tiers have affected more the first tier, meaning the dialogue and the local peace agreement has been seriously impacted. The second tier, physical protection, was less because even though our activity was a reaction activity instead of a preventing activity, but we've managed to do a certain number of things. The third tier also has been affected. However, when we take the first tiers, it's very difficult for our colleagues who has a reduction of staff at the field level to continue engaging with the communities, or they are not on a team, Microsoft or things. So what needed is a physical engagement with the people, which is a little bit risky for our colleagues. Even despite that, they continue doing it. It's more complicated to engage with armed groups in that particular environment, but nevertheless, at the higher level, like the senior management engaging with the armed group leaders, with the politicians, with the government, that's when it's continued. The last meeting we have related to the Bangui Peace Agreement, it's what we call it CS, Comité Exécutif de Suivi, which is a kind of, a coordination mechanism related to the peace accord. All the 14th armed group has met with the guarantors, UN and the African Union, to go through to commit to a certain number of things. Yes, the second CS, which is a physical protection, I think we are quite okay on that one. We are trying to be, instead of being proactive, like I'm telling you, all our CLAs, community liaison assistant, in the 14 COBs are operating. We are very much on early warning mechanism, and what is missing, it's how to organize quickly the response. But nevertheless, also our human rights activity is like a monitoring investigation has been seriously impacted. But however, we were in a situation whereby mission has waived the restriction to allow our human rights colleagues to go in the field to do their activity. The last one, which is the last year's create a protecting environment. You have to admit with me that all what is training or the engagement, empowering capacity of our partners have been seriously impacted. However, our UN pool, the continuing, supporting the ECOL the police. They are now trying to, because we are in a electoral period where at the end of this month, at the end of this year, we're supposed to hold the election. So we need to recruit 2,600 FACA. So I'm doubting how are we going to do that one. And also the call of police has been supporting on a training on a weekly basis. So let me leave it there. If you have a concrete example you want to ask me, then I'll be ready to respond. Thank you very much. You're on mute.
Thank you so much, Kofi. There are indeed a lot of dilemmas faced by peacekeepers right now in terms of managing this environment where the anti-UN sentiment is rising and continuing to operate and to engage with communities when they have to actually take that distance. So thank you for raising all these. And I will now turn to Caitlin, who works on child protection issues in the Congo, a country that has been fighting Ebola before being confronted with COVID-19. So maybe Caitlin, if you can tell us about the lessons that can be drawn from this experience and the specific repercussions of both epidemics on the protection of children. Thank you.
Good morning, ladies and gentlemen. Thanks for inviting Save the Children to this event and for allowing us to highlight the impact of COVID-19 on children affected by conflict. Save the Children has been working for the benefit of children in situations of conflict for over 100 years, starting with those children affected by the First World War. In conflict-affected countries, boys and girls are vulnerable to and experience grave violations of child rights in conflict, as defined by UN Resolution 1612. These include killing and maiming, recruitment and use by armed groups, sexual violence, abduction, deliberate attacks on schools and hospitals, and denial of access to humanitarian assistance. Children and families in conflict also experience displacement internally and across borders, deprivation of liberty and freedom of movement, family separation and economic hardship, psychosocial distress, limited access to health, education, and social services, and increased levels of violence, abuse, and exploitation within homes and communities. So what does an epidemic or a pandemic mean for children? We believe that border closures and impacts on trade will increase economic hardship everywhere, of course, creating a range of risks, among them hunger, malnutrition, and associated diseases, and vulnerability to sexual exploitation and abuse, as we saw in the West African Ebola response. We'll see very weak health facilities, some of which are already directly targeted by armed groups or are collateral damage when explosive weapons are used in populated areas. having to respond not just to existing illness and childbirth, but to COVID-19. And this will definitely increase excess maternal and infant mortality. We'll see increased sexual violence as children are out of school, and violence in the home as well against children or other household members. We'll see significant stress for both children and parents, resulting from a lack of understanding and fear, the closure of schools, movement restrictions where they exist, and reduced household income, among other things. We'll see reduced contact between children and teachers or social workers, increasing the risk that children in need of support will fall through the cracks. We may see increased numbers of children associated with harmful labor, for example, in mines, and increased numbers of children on streets, increased arrest of those children because they're on the streets. We expect increased recruitment of children who are out of school by armed groups, and a slowdown in release and reintegration processes for children associated with armed groups, which we've already seen in both DRC and South Sudan, for example. One knock-on effect of that is that we have limited capacity to support newly separated children, as the transit centers and foster families are full, for lack of a better word. We'll have reduced NGO and UN presence in communities to monitor and report on protection concerns, including grave violations. And we're seeing that in DRC already. And finally, we've seen continued fighting resulting in displacement and grave violations against children. Despite the call from the UN Secretary General for a global ceasefire, we've seen all 6 grave violations continue in places like Yemen, Afghanistan, DRC, and South Sudan. More than 660,000 people have been displaced due to conflict since the pandemic began, including more than 480,000 in the DRC in just the past 2 months, unfortunately. So yes, the pandemic is a public health emergency, but it's exacerbating existing protection crises and patterns of marginalization. It's important that while countries try to respond to the epidemic, they continue with commitments to address child protection and other humanitarian needs. Despite all this, resourcing of child protection services is currently quite difficult. A recent pre-COVID-19 report by Save the Children, it's called Unprotected, found that child protection received an average of just 0.5% of humanitarian funding. With the justifiable focus on healthcare at the moment, we may see a net decline in humanitarian funding for child protection. There's a lot of adaptive guidance out there that's been developed with the support of the Global Alliance for Child Protection Humanitarian Action, case management, and children associated with armed forces and armed groups, several other areas, and certainly share the details of these for anyone who's interested. I'd like to share a few positive examples of how Save the Children and others are adapting programming. In Iraq, community-based facilitators are assigned in specific locations as focal points for identification and referrals, dissemination of protection messages, and provision of remote psychological first aid. In the DRC, we're establishing hotlines for children so that they can reach out directly to trained respondents and get access either to information or to child protection professionals who can support them if they're at risk. These are just a few examples. To end, I'd just like to make a few recommendations. First, child protection, MHPSS, education, and response to GBV must be prioritized and designated as essential services. So in this regard, the child protection workforce must be classified as essential frontline workers, as health workers are, and equipped with the means to carry out their functions, and this includes PPE. International donors and governments must ensure child protection, education, MHPSS, and response to GBV are included and adequately resourced within humanitarian response plans. And that's not happening across the board right now. We learned in the Ebola response in West Africa and in DRC that public trust in the response is critical. So risk communications have to be appropriately tailored to the audience, including children and marginalized communities. And that means speaking in local languages. As practitioners, we must understand the drivers of sexual exploitation and abuse in our particular context, and we must ensure that we act to counter those situations within our programs. One example is to maintain school feeding programs, even where schools are closed. And last, donors, agencies, and governments must ensure that investments made in services during the response, including formal protection mechanisms, do not end at the end of the response, whenever that comes, but transition into longer-term system strengthening. Thanks.
Thank you so much, Caitlin. And I will now give the floor to Ms. Heather Barr from Human Rights Watch and the Women's Rights Division of Human Rights Watch. So please, Heather, the floor is yours.
Thank you, and thanks so much for inviting us to be part of this interesting discussion. I'm going to echo some things that some speakers have already said, but I wanted to start by saying that it's kind of amazing how much this is actually a global crisis for women. So women who were in settings that were already in crisis are experiencing extra layers of difficulty during this pandemic, but this is a crisis for women across all different kinds of countries and settings and levels of economic status and so on. And so I wanted to start by sort of talking about how our team has thought about what those big global issues are, because they're relevant in crisis too. And so we've kind of divided it up into 4 areas. One, of course, is gender-based violence. Several people have mentioned this already. Huge spikes in reported levels of gender-based violence, particularly domestic violence, but also sexual violence, violence against girls who are now out of school in lots of countries. And so that's a serious concern. Second area that we're thinking hard about these days is sexual and reproductive health. As you know, the supply chains have been interrupted, supplies are not available, manufacturers are warning of a global condom shortage, thousands of clinics that provide sexual and reproductive health services have shut down, movement restrictions, lack of staffing have really cut a lot of women off from those services, including during labor and birth, but also for access to contraception, access to abortion, all kinds of other services as well. The third area that we're looking at is girls' education and the disproportionate impact that school closures are having on girls and also on women. So we're really concerned about how school closures are going to affect child marriage rates, sexual violence rates, pregnancy rates among girls, about what kind of disparities we're likely to see in terms of gender when children go back to school, about are as many girls going to go back to school as boys. And then we're also thinking about how the increased caregiving responsibilities caused by school closures have impacted women. And so the fourth area that we're looking at is economic and workplace impacts. Leticia has already talked about attacks on healthcare workers. As you all probably know, 70% of healthcare workers globally are women. So they're bearing the brunt of those attacks. They're on the front lines and trying to provide care. They're also often in other categories of work that have been classed as essential: food production, providing food, selling food, grocery store clerks, these kinds of jobs. So one issue is increased risks that women are facing at work. Another is the likelihood that they're losing their work and their income, and that they're more likely than men to have been paid less to start with and to be in occupations that don't have any protections, don't have any safety net available to them because they're in the informal economy or otherwise marginalized, such as domestic workers. So many of these risks are also affecting women and girls in conflict settings and other settings where there's a humanitarian crisis. I just wanted to mention 3 areas where I think COVID-19, gender, and pre-existing crises come together in a really harmful way. One is water and sanitation. We all know that washing your hands is important. Water and sanitation has been an area where women in crisis settings have struggled for a long time before this crisis. Often they can't safely access toilets, latrines, water points because of concerns about sexual violence, because of poorly designed camps, because of lack of freedom of movement for women and girls. And that's really a crisis in this situation. Second is services. Services for sexual and reproductive health for gender-based violence have always been incredibly short, so in very short supply in crisis settings, and this situation is increasing need and often decreasing supply. And then I was going to talk a little bit about information, but I'm running out of time, so I'm going to skip to recommendations. The most important recommendation is that we can't dial back funding and provision of services for women that's specifically targeted at women's needs in crisis settings. Sexual and reproductive health, gender-based violence services, girls' education. We should be doing more of all of these things, not less. And so we can't let funding and efforts be reallocated away from that. And agree completely about these services always being essential. And then finally, just to say that long-term recovery planning has to be gender responsive and has to think about what impact there's been on women and how we repair that. Thank you so much.
Thank you so much, Heather, for this overview of the gender impact of the health crisis and your recommendations. So now we'll turn to Natasha from OCHA. Natasha, we have touched upon a lot of different protection issues induced by COVID-19 and containment strategies. So given the coordinating role of OCHA and the global perspective you have from the HQ, maybe you can tell us more about your analysis of these trends and the global response plan to address them. Thank you.
Thank you, Namie, and a good day to everyone who has joined us online today. A lot has already been said, so I'll try to remain succinct and conclude with three broad recommendations from a humanitarian perspective. For people already struggling to cope with conflict, displacement, and hunger, COVID-19 adds another layer of insecurity. And in complex settings, the virus can easily grab hold and overwhelm crippled healthcare systems with deadly consequences. And we're already seeing this in Yemen, where the number of cases increased by 325% in a week, with an alarming fatality rate of 15.9%. So as atrocities across the globe continue unabated, the pandemic is putting international legal protections under additional strain. It's deepening inequalities, exacerbating protection risks, and disrupting protection capacities. Vulnerable, as we've heard, vulnerable groups are most affected. They face heightened risks of violence and discrimination. Violence against women has surged at a time when safe houses are severely curtailed. Children out of school are at greater risk of child recruitment and early marriage. Older people face age-based discrimination in accessing healthcare. And people with disabilities are at an elevated risk of neglect and abuse. People on the move are subject to growing levels of stigmatization and xenophobia and have been trapped in perilous situations. Asylum seekers and refugees have been denied international protection, migrants have been forcibly deported and detained, and IDPs evicted. Meanwhile, fear and uncertainty, which is being fueled by misinformation and hate speech, is increasing the levels of psychological distress and violence. Another disturbing trend that we see is a heavy-handed enforcement of lockdowns and curfews. Multiple accounts of excessive use of force has resulted in death, injury, and ill treatment of civilians. And shockingly, in the midst of this pandemic, attacks and threats against healthcare and humanitarian workers and facilities has increased. According to Insecurity Insight, fighting and the use of explosive weapons in Libya has damaged at least 7 hospitals and forced the closure of over 30 health facilities in April alone. In the Central African Republic, 14 incidents against humanitarian workers were recorded in Dele in the first 2 weeks of May, resulting in a suspension of humanitarian activities. So as protection space is shrinking, internet shutdowns and new movement constraints are hampering our ability not only to reach and assess people in need, but also to protect by presence. So faced with these colossal changes, how do we safeguard civilians in the COVID era? And here I offer 3 broad thoughts. First, the virus does not discriminate, nor should our response. It must be shaped by inclusion, protection, and the meaningful participation of all vulnerable groups, as showcased in the Global Humanitarian Response Plan, the UN's GHRP. Political and religious leaders should speak out and take action against discrimination, hate speech, and ageism arising from the pandemic. Second, we need to adopt a do no harm approach. To avoid unintended consequences, humanitarians are taking precautions to protect others and themselves by adjusting delivery modalities. And we're using innovative ways to do this with digital technologies and communication. We're strengthening our protection from sexual exploitation and abuse efforts, and engaging communities and strengthening our work with local actors to build trust and counter stigmatization. Relevant authorities must ensure that restrictions on free movement are necessary, proportionate, and non-discriminatory, and must put in place measures to ensure unhindered humanitarian access. Third, now more than ever, compliance with international humanitarian, human rights, and refugee law is vital to stop the pandemic and save lives. We should continue exerting efforts for the realization of the UN Secretary General's call for a global ceasefire, but where conflicts can't be resolved, respect for international humanitarian law can make a difference by protecting healthcare and frontline responders, by enhancing safe and rapid humanitarian access, and by ensuring that those fleeing violence and persecution have access to protection. The health crisis is quickly becoming a protection crisis. Collective and urgent action is needed to strengthen the protection of civilians so that we can tackle the pandemic and safeguard humanity. Thank you.
Thank you, Natasha. Thank you for these very concrete recommendations. The need to fight discrimination, to adopt a do no harm approach, to respect IHL. I think we have covered a lot of different challenges and identified some potential recommendations. So I think now is a good time to open the Q&A session with the audience. So I will open the floor. To ask a question, please type your question into the Q&A box at the bottom of your screen. I will make a selection of questions and read them to our panelists to answer to them live. Alternatively, participants can also use the raise hand function if you want to be given the floor and ask your question directly to our panelists via audio. I will ask you to be brief to allow time for a dynamic conversation. And as we receive questions, I will start by giving the floor to His Excellency Mr. Gert Ovart, the Deputy Permanent Representative of Estonia to the UN.
Thank you, Madam Moderator, and all organizers of today's event. Especially good to see Ilse again, and James, you as well. And I would extend even greater gratitude to the speakers for their invaluable insights and examples of how the protection of civilians has been impacted both directly and indirectly by the ongoing COVID-19 pandemic. In these times, the protection of civilians relies more than ever on your effective and coordinated work. Without continuous vigilance and effort, any progress on the POC can quickly be reversed. As the attention of governments and the international community is on the pandemic, some conflict parties have sought to take advantage of this situation. Regrettably, for some authorities, it has provided a pretext to adopt repressive measures for purposes unrelated to the pandemic. This means that the resilience of the civilians, as pointed out by ICRC President Maurer yesterday, is stretched further. Unity in approach is key here. That's why we have continued to strongly support ST's call for a global humanitarian ceasefire and the need for the Security Council to pronounce itself on this. We need more protection, not less. And as many speakers emphasized at yesterday's Security Council open debate, humanitarian aid for civilians in need must be facilitated, not impeded. In yesterday's debate, we also wanted to raise the role and protection of women, civil society, and human rights defenders in the context of the pandemic, a key to mitigating the crisis. I can assure you that in the Security Council, Estonia will keep striving to ensure for greater compliance with international humanitarian law and international human rights law. I would, given the constraints of time, give you two questions now. And the first would be, what changes implemented for the protection of civilians as a result of this health crisis would you recommend continue implementing also after the pandemic is over? And secondly, there are examples in the past where external actors have experienced stigmatization or xenophobia at times of extraordinary crisis. Have you observed something similar during this pandemic? What measures have proven effective in combating such stigmatization? I thank you very much.
Thank you, Ambassador. I will also give a floor to the Deputy Permanent Representative of Indonesia, Ambassador Mohammed Koba, for a brief intervention to start off the conversation before I take more questions from the audience. Thanks.
Thank you, Dr. Di Razza. Also, thank you, the UK, Estonia, Niger and Canada, and all co-sponsors for organizing this relevant discussion and very timely discussion. It is important for us not to generalize about the impact of COVID-19 in conflict-affected areas. Some countries are severely affected, while others have only begun to report confirmed cases. Some countries are able to take significant measures to prevent the transmission of the disease, while others have seen worse situation due to the continued armed conflict. What is more important now is, with the spirit of global solidarity and international cooperation, is to urgently support those who are most vulnerable to the virus, particularly in armed conflict. And as the chair of the Foreign Policy and Global Health Initiative this year, we strongly advocate for the availability, accessibility, and affordability of healthcare for all, including in armed conflict. I think James earlier mentioned about the importance of the availability of vaccine. I would like to take this opportunity to appreciate the UK for their work on this field. I think a few weeks ago, we had a virtual teleconference with Professor Sarah Gilbert, and she mentioned about the possibility of collaborating with the developing countries, the development of vaccine. I think that is very important. Now, I have 2 points. First, we fully support the call for an immediate global ceasefire. It is an extremely important call for all parties to conflict to focus on the handling of the impact of COVID-19, provide respite for civilians, facilitate delivery of humanitarian assistance, and open space for continued diplomacy. The second point is actually more like a question to the panelists. I think very urgent and timely to be addressed. Do you see any innovative step for our peacekeepers on the ground to better engage communities during this pandemic? And the second one is how to promote the respect to international humanitarian law by all parties to armed conflict in order to ensure safe and unhindered humanitarian access in this very difficult moment. Thank you.
Thank you, Ambassador. So I will now take a few questions from the audience. I think we'll only have time for one round of questions. So I will ask you to please send them now. So I have one question, and I will answer it live, from Riyadh, Geneva, about Palestine. And he asked that question. All humanitarian organizations in Palestine face several obstacles from the Israeli occupation power, restriction of movements and of goods and individuals before the pandemic. Actually, Palestinian detainees, especially children, remain in danger of COVID-19 infection and mental health-related impact in the crowded administrative detention centers. How can the international community intervene to protect Palestinian children? So that's one question. I will also answer live another question on communication gaps. So the question is, to fill in communication gaps for COVID-19, there has been a reliance on communication technologies, including through virtual means. How will this be possible in areas where there is limited, weak technological infrastructure? And I think some speakers already touched upon that. And we also have a question from Belgium. So the question is, and I will summarize, but COVID-19 is a protection crisis, but also a crisis of trust, as a lot of vulnerable groups and communities in conflict situations lack trust in the government's messages while non-state armed groups lack trust in international media. This could evidently give rise to serious COVID-related problems now, as well as when a vaccine will be available. On the other hand, we've heard about positive effects as well when non-state armed groups have been useful to spread correct information and preventive measures among the population. So in light of your expertise, especially the ICRC, but possibly others, MINUSCA, on the engagement with non-state armed groups, could you assess their role with respect to this issue and how we, the UN, should adapt our approaches and support accordingly? So I will now go back to the panel because I don't see other questions. So let me maybe turn to Laetitia from the ICRC. And please, Laetitia, if you can try to be brief and also use this time if you want to make an additional remark or concluding remark. Thanks.
Thank you very much, Dr. On the Palestinian detention context, thank you very much for raising the question. I'll just try to answer with a little bit of a broader perspective. The detention places are a particular population of concern, considering the widespread and of the virus in those places and how it can be contained in Palestinian, but in many other places of detention that we visit also worldwide. We've been trying to focus on maintaining access to this population, but also changing the terms of our approach, looking more as from a public health perspective, trying to accompany the authorities as well with regards to how to step up on the health response, step up on the preventive response as well, and to make sure that adequate measures such as addressing overcrowding, for instance, are taken the sooner than the later. So just on the Palestinian aspect, we do continue visiting those places, favoring a direct approach and a direct dialogue and bilateral dialogue with the authorities concerned. As to the non-state armed groups, of course, they do have a major role in, first of all, providing access to the areas they control, and also passing clear messages to the population in those areas. Facilitating the entry of humanitarian actors, but also, as Natasha mentioned, as bringing as well and facilitating the contact with the community leaders and leaders that can also convey the right messages. We have very good examples in the Sahel where we had discussion with Muslim leaders and leading to adoption of one fatwa on COVID-19 fight and the prevention and the protection also of medical services and management of the death. So that's a very good example where we can actually achieve jointly a progress in terms of protecting the public services, but also the population at large with regards to this answer. So it is an obvious interlocutor and influencer that we can't just put aside in that particular moment.
Thank you, Laetitia. Kofi, if you want to take the floor now. Oh, well, I think. Sorry, I'm sorry. Please, Kofi, go ahead.
Okay, very briefly, in the context of MINUSCA, we continue engaging with the non-state armed groups. They have signed a peace agreement last February, and they were 14. But the thing is, if the armed group doesn't have a political agenda, they are more, they have interest. Their interest here is economic. They are controlling, the mind. They are doing business instead of doing politics. So what we've witnessed, most of them are not controlling really their element. So they can commit to do a certain number of things. We keep on pushing. We keep on, giving a chance to the peace accord. But if they are not willing, it's like we have a current crisis going on in a border with Sudan and DRC, which is Obo, where the armed groups, they have attacked the town, they have been repelled by the National Army supported by MINUSCA. But the leaders have denied it. It is saying that, no, these are the community who organize themselves to attack the town, which is completely wrong. They say one thing today, they'll say another one tomorrow. So the only thing we are doing now is to, bring them around what they have committed to in their peace agreement, and try as much as possible to to make them respect those accords. That's why I've cited in one of the examples I give that they have brought to Bangui on the 22nd of May to discuss where do we stand with the peace agreement. So for now, this is what we can do, keep them around the table, keep engaging them, and while exercising also, some military pressure on them in order to bring them, around the table. Yes, engagement, but also military pressure, and also we have to start applying all the sanction which goes along with the stated in the peace agreement they have signed so far. So far, it's not happening, but we have to start doing that one, applying the sanction. Thank you very much.
Thank you, Kofi. Caitlin? Caitlin, you are on mute.
Okay. Sorry, I was on mute, as you know. I just wanted to quickly say, although Leticia from ICRC gave a great answer, but Save the Children has been urging the Israeli authorities to take immediate action to release Palestinian children detainees in Israeli prisons and detention centers so that they can safely return to their families and communities. There needs to be a moratorium on new admissions of children in the detention centers. And this is especially important now, of course, due to the vulnerability created by coronavirus. I think from a more NGO perspective, a more agency response perspective, I'd say that there's a lot of there are a lot of mechanisms to try to maintain engagement. I'm not sure if these are able to be used in this context. So I don't want to go into detail, but there are a number of adaptations and guidelines that have been written. And I think that includes children in detention. So yeah, we can share those details afterwards.
Thank you, Caitlin. Heather, if you want to take the floor now.
Oh, thank you. Two super quick points. First, on Palestine, Human Rights Watch and a large group of other human rights organizations have put out a statement on what we believe the government's obligations are. So you can find that on our website if you're interested. Second, I wanted to go back to the one of the recommendations I ran out of time but can't skip, which is women's participation. I hope we've all learned a lot from all of the work that's been done on Security Council Resolution 1325 over the years about how women's participation in peace processes is essential, not only because it's women's right, but also because it makes these agreements more likely to come together, more likely to be successful. We should apply everything we've learned about women's participation from 1325 to this situation, and not just to peace building efforts, but actually also to responses to the virus. Some of the issues we talked about gender, we're not going to get those right if we don't have women involved in planning the response. And we see lots of countries where that's not happening. So that's my last thought. Thank you.
Thank you. So let me now give the floor to Natasha. And Natasha, I also received an additional question, if you want to respond to it, on cyber attacks on hospitals that were actually mentioned in the SG report. So if you have any examples, what kind of attacks, if you can elaborate on this, what are the objectives, what is the impact and the context of these attacks, it can be helpful, but I will let you take the floor now. Thanks.
Thank you, Namie. Well, first, to address the question on xenophobia, which can lead to pervasive discrimination, violence and exclusion, we're ensuring that strategies to counter stigma form part of the humanitarian response. And it's not only vulnerable groups that are exposed to these issues, there's also been an increase of threats and attacks on health and humanitarian workers, increase in anti-foreigner sentiment. Last week, the UN launched a new initiative called Verified to combat misinformation, which often it's where xenophobia kind of takes roots and proliferates through disinformation. So this platform aims to transmit trusted information. We're also using our community platforms and networks, the risk communication and community engagement and mine risk education networks to build community acceptance and ensure greater tolerance for different people in the communities and reduce inequalities. On the question on community gaps, we're using obviously the more traditional means of communicating with the communities in terms of megaphones in some of the Cox's Bazar camps in order to raise awareness of and about the threat of COVID, but also for against stigmatization. Our mine risk education partners use a free digital app such as Zapier in Myanmar that doesn't require internet services. But in Darfur, we're piloting a solar-powered talking device. So there are a few examples. In South Sudan, we use the radio where 2/3 of the population are illiterate. Just to finalize, maybe in terms of opportunities that COVID brings, and to address the question on implementation of IHL, what are we seeing? Well, the Secretary General's global ceasefire opens windows for diplomacy. It allows us to renew dialogue with armed groups on access, negotiate on safe release of children. There's also been opportunities to release detainees, including children from detention facilities. It's building our capacity with local partners. And this outbreak has also the potential to add a new perspective and urgency to the number of issues related to inclusive humanitarian action, particularly in terms of the inclusion of older people and psychosocial support. So we need to build better from this pandemic in order to ensure the protection of the civilians moving forward. Thank you.
Thank you, Natasha. And finally, I wanted to get back to Kofi, because I think Kofi wanted to add something on community engagement. And also, if you will, there was also a question on the need for joined up efforts across UN actors on protection of the civil society space and human rights defenders in the context of COVID-19 response. If you had any thoughts on this as well, but the floor is yours. Thank you.
Okay, thank you very much. Regarding our peacekeepers, meaning those who are in uniform engaging community, as we know, they are doing a great job, especially in Central African Republic. But they don't just have the skills of engaging the community as such on a certain number of things. We don't want neither to raise more expectations. So how we are trying to deal with this thing is whenever we have a rotation of a contingents, we are trying as much as possible to take them through a 1 week tactical training on protection. We give them the ABCD of protection, comprising even how to engage with the community. But this is something people have been doing for years, but we cannot expect uniform personnel who just arrived in the country for some of them 6 months, for others a year, to be doing it. They might come across some of those issues. That's why we put in place some tools like a joint protection teams meeting, where we in civilian traveling in one's location to assess and engage with the community and put in place some of the corrective mechanisms in place, or kind of what we call now, where we are not civilian are not present, alongside with our military colleagues, what we call search capacity team, which are traveling in some bases where the uniform personnel are, in order to to support what they are doing in terms of security and protection, and while civilian engaging with the population. Somebody has raised the issue of xenophobia. At the beginning of this COVID-19 crisis, we've seen some of the international experts has been verbally attacked because simply that the first cases arrived in Central African Republic was brought in by, a foreigner. So it was not easy. People have been aggressed in a restaurants on the streets, but now it's quite okay. Regarding the issue of, UN effort, joint effort for civil society and human rights defender, yes, they are the future. So we need to empower them. As far as Bangui is concerned, I think our colleagues in the human rights session, they are trying to put in place a program to empower civil society. But it's only in Bangui because the rest of the country, this country has been in war, and we don't have a very strong or a strong civil society to empower. Compared to MONUSCO, where ASG has said that we have a strong network of civil society across the country, comprising, I know that Joint Human Rights Office also have a program called Human Rights Defender. I'm saying it because I was the coordinator of that program where we really empower human rights defender and the journalists. Thank you very much.
Thank you very much, Kofi. And unfortunately, I'm conscious of the time, and I really want to give the floor to His Excellency Mr. Abdou Abari, the Permanent Representative of Niger, and Mr. Richard Arbeiter, the Deputy Permanent Representative of Canada, for concluding remarks. So, Ambassador Abari, you now have the floor.
Excellencies, let me begin by thanking the co-organizers of this important meeting as part of the Protection of Civilians Week, namely the permanent missions of the UK, Canada, Estonia, as well as OCHA and IPA. I would also like to thank the briefers for their excellent presentations as we reflect on 20 years since the Security Council Resolution 1265, the Council's first resolution on the protection of civilians in armed conflict. Madam Chair, in the past few weeks, we have seen an unprecedented surge in global action to tackle the various consequences of the COVID-19 pandemic. We must continue our efforts as the situation on the ground in many conflict areas is deteriorating at an alarming rate, especially for vulnerable communities, including refugees, internally displaced persons, women, children, the elderly, and persons with disabilities, as many of the speakers have noted. The exchanges have been extremely rich, and it will be difficult to resume all the important points. In these concluding remarks, I would like to further the reflections on a few key points raised by this conference. Firstly, as all the previous speakers have noted, the COVID-19 pandemic has exacerbated an already dire situation with severe consequences on endemic humanitarian crises in fragile states. I note in this regard the case of Sahel countries where the COVID-19 pandemic is not only a health and economic crisis, but also a growing threat to regional and global security. The Central Sahel region shelters over 1 million refugees and IDPs, the majority of whom are women and children. The Sahel and Lake Chad region has seen a sharp increase in the number of internally displaced persons, with Chad and Niger the most affected. This region, plagued by all kinds of attacks carried out through asymmetric warfare that spares neither the defense and security forces of our countries, nor even peacekeepers, let alone civilians. Emerging trends show that terrorist groups may be trying to take advantage of the situation to gain ground at a time when the attention of many governments is focused on the fight against the disease. Recent attacks in the region confirm these fears. The SG's call for an immediate global ceasefire is therefore a lifeline for many communities which have already seen unprecedented sufferings. Secondly, another key point that transpires from our discussions is the need to reinvigorate our commitment to the women, peace, and security agenda, particularly in the context of our response to the COVID-19 pandemic, one of the unfortunate and unintended consequences of the measures taken in the face of this pandemic is the worldwide alarming increase in the incidences of gender-based violence and violence toward children. We must ensure that measures account for the gender dimensions of the crisis and how it amplifies existing inequalities. For a post-COVID-19 response, the attention to the gender dimension of the pandemic's social and economic consequences is particularly relevant in African countries where women constitute the majority of the workforce in the informal sector. Most importantly, the involvement of women in peace building is important, as women are the pillars for the consolidation of peace and above all for conflict prevention. Third, as highlighted in the latest Secretary General report on the protection of civilians, there are growing attacks on essential civilian infrastructures and objects, including schools and health centers, by non-state and state actors alike. In the Sahel region, direct and indiscriminate attacks on schools have deprived over 500,000 children of education. Now with COVID-19, many more are simply not learning owing to the lack of proper mechanism to reach the majority. An attack on education is an attack on the future. The ongoing and past COVID-19 responses in the protection of civilians agenda must remain vigilant to how measures adopted to mitigate the spread of the pandemic, albeit necessary, have affected the most vulnerable children in their rights to education, safety, and protection. Excellencies, our commitment to safeguard peace and security is only as meaningful as the political and economic muscle we deploy to defend it. Niger remains committed to the protection of civilians agenda. My country was one of the first in Africa to adopt a national law in 2018 for the protection and assistance of displaced persons fleeing violence, floods, and droughts, in accordance with the Kampala Convention, which established principles of the protection of displaced persons. Lastly, we should also bear in mind that the success of the protection of civilians lies in an inclusive consultative process that engages local communities and that promotes social cohesion. It is only then that lasting solutions could be achieved. We welcome, as some of the speakers have noted, the innovative approaches to the protection of civilians that are increasingly embedded in mandated peacekeeping operations. A common point which all speakers have referred to is the need for equity in the ensuring treatment for COVID-19. I join these calls. When a safe and effective vaccine is discovered and developed, let it be people's vaccine accessible to all. This would be a cornerstone of the protection of civilians agenda. We cannot, must not tolerate a world where civilians continue to be the target of inhumane violence. I thank you, Madam President.
Thank you so much, Ambassador. And let me now turn to His Excellency Ambassador Richard Arbeiter, the Deputy Permanent Representative of Canada. Ambassador, you have the floor.
Thank you very much. C'est un grand plaisir de vous voir, Monsieur l'Ambassadeur du Niger. I agree entirely with what our colleague, the Ambassador of Niger, just said. Very substantive points. So I'm not going to cover the substance because I think he did, and I particularly want to support his comments around equity and equality. If I can just offer a general reflection here, based both on his comments and Heather Barr's recommendation that we learn the lessons of the past 20 years. And my reflection is this, demonstrated very ably by this conversation that we've had today, is that the POC community is very sophisticated and it's evolved over 20 years. And I'm amazed at how quickly all parts of this community have been able to identify and analyze the situations locally and what that means globally for all of us. And so many of you had ground truth, reality recommendations, both to acknowledge what is working, where the gaps have been exacerbated, where the inequalities have been exacerbated as well. And it's really quite something to kind of stand back from it and see how quickly and ably we are able to figure out what needs to change in order for those that are most vulnerable to receive the support that they need. So with that, let me thank in particular the representatives of the humanitarian actors here. Agree entirely on access. You're the front lines. We owe you. It's just accidents of birth that we're where we are and not where your colleagues are supporting others. So thank you for all that you do and what your colleagues do as well. Secondly, to our UN agencies and to those on the ground in MINUSCA and elsewhere, we are acutely aware that the pressure is much higher and much greater in helping to serve those communities as well. We're thinking of you and we want to help you as best we can. And then finally, of course, to colleagues from member states, especially those that are currently on the council right now, and Estonia as presidency for the month of May. Thank you for ensuring that this POC week was as visible as previous ones, that the debate yesterday, the concentration of focus here in New York was not lost, that POC was not the POC week here was not a casualty of COVID as well, but rather allowed us to harness that sophistication, that knowledge, that analysis, those gaps, so that we can hopefully collectively do a better job moving forward. And finally, of course, to IPI, thanks for bringing us all together and allowing us to learn from each other and hear from each other today. Thanks, everyone. Merci beaucoup.
Thank you, Ambassador. I think today's discussion was extremely rich, and I really want to thank all speakers for providing so many practical insights. Of course, the challenges are enormous, and I think we only initiated a conversation that should continue over the coming months and the coming weeks. So thank you all for participating in this policy forum and following us online. Thanks to our speakers, thanks to our partners, the UK, Canada, Niger, Estonia, and OCHA. A recording of the event will be made available on IPI's website. And please don't hesitate to join us for our next event on the protection of civilians tomorrow at 3 p.m. New York time, a policy forum that will be focusing on the impact of the Kigali principles on the protection of civilians. Again, thank you to all and have a great day.